Just a few rules of housekeeping as we begin. At any point in time, if you do need to use, the building does close at 7 o'clock. If we run over, we will be able to exit out this door and off this door immediately out this hallway. The facilities are just down this hall to your left. And if at any point in time anybody does need to step out for any reason, please feel free. This is not class, so we're trying to be as open as possible. My name is Kevin Patterson. I'm the county manager for Scotland County, and I'm not the public speaker, but I wasn't able to find somebody else to take the role. So the reason why we're meeting is last year that we had a settlement. Scotland County was part of the national multi-action lawsuit against opioid vendors. And with that, Scotland County was one of the agencies across the country that were awarded. We've been awarded just under $3 million, but that's over the next 15 years. So it is not a significant amount of money at any point in time. But it's something that we're looking to direct, and it needs to be spent just on opioid services. But one of the primary reasons tonight is really to start a conversation. We've been having, since last summer, we've been having meetings on a regular basis with our healthcare system, with our mental health providers at East Point, with law enforcement, with health departments, social services, school systems have been involved. Looking at it from a agency issue, these are the structural components where we know there are weaknesses, where we know there are gaps. We did an analysis there, but one of the things that we know we needed to do is go out and have a conversation in the community and find out exactly, first of all, tell people what some of the resources are available, because chances are none of you know what resources are available. And first of all, you're here, but also because of the incidence of substance abuse or drug misuse, or however you want to call it, it touches most everybody's life in Scotland County, actually nationally. If it's not yourself, if it's not a close family member in your household, you know of someone whose household this is an active issue in. And with that substance abuse, it's always very easy to villainize substance abuse. It's always those people, they. And we've all seen movies. I love Scarface. It's a great movie. But that's not your prototypical drug person who uses substance abuse. Substances are misused by people of all races equally. It is not an issue of poverty. Economics does not really go into it. The difference is someone who is working minimum wage does not have the resources to cover up the issues from their substance abuse. When I would have the resources, I can hide my substance abuse longer than a fry cook can. That's the difference. But frankly, the number of people who are addicted or struggling does not change based on income. It doesn't change based on demographics. It really doesn't change much on demographics. It doesn't change on political party. It doesn't change when you look and if you go to a building on weekends, if you go to church or not, it's still there. So what we were hoping to do is start a conversation in the community and make it very public that we know this is an issue, and hopefully we can create the start of a safe conversation. A lot of people don't want to raise their hand and say, yes, I'm struggling with substance abuse. Yes, I'm struggling with alcoholism or whatever. Or my spouse, my husband, my wife, my parents, my children are struggling from this. I've known a number of very good friends. I've had substance issues in my family, very close to me. I know a number of people that I've known for a number of years who are upstanding members of the community, who years later they told me, okay, oh yeah, my child was suffering from this. I had a spouse who was suffering from this. And one of the things to it is someone who had resources, they went out of county to get help, to walk into a room full of people from Scotland County getting help because they didn't want anybody to know, because they were ashamed. And that is one of the problems that we all need to face. So that's the reason for having just a conversation that we want to start. We want to normalize our conversations about people needing help. Our community, whether it's been through poverty, layoffs, hurricanes, we've all come together. We've seen, during Florence, we had 600 people who were displaced from their homes over a weekend. Nobody went without a home that weekend, for that week. People found a place because the community came together. So the community that we have here is caring. They always reach out. We just need to make sure that this is not something that people refuse to ask for help on. Also, because substance abuse is a dirty secret, it's hard to go off and say, you know what, we have providers here. We don't have enough. Absolutely. But we do have resources. And the more they're used, hopefully the more we can bring in. So that's also the first part of what we're going to be doing tonight. I'm going to ask some of our providers to speak briefly, just to introduce themselves. And then we'll go off and start having a conversation for anybody here. Any questions so far? All right. The first person I'm going to ask to speak is, I'm also terrible with names. I've only known him for as long as he's been in.
I'm bad with names too. Dave Pope. My name's Dave Pope.
I knew it until I needed to call him. We only go to church together. Come on.
Kevin, thank you. Appreciate it. So first off, thank y'all for showing up. I feel like I'm preaching to the choir because anybody that would come out to a community event and learn more about this is already somebody that's interested in this. So thank you for that. At the very end of this, I'm going to ask you to not only just be the choir, but to be the evangelist as well. So, you know, for something like this to work, it takes partners, so I'm really glad to be here with the other folks who are in this room. It's us as a community working together that will be able to make an impact on it. So let me go back 2 weekends from this coming Sunday. Does anybody remember what big event was on the TV?
Super Bowl.
Yeah, Super Bowl, right, okay. So let me see who the Chiefs fans were. All right, good, good. Anybody Eagles fan? Some Eagles fans, right? Why are we fascinated with the Super Bowl? It's not just the fact that you like to watch the commercials. It's the fact that people want to be number one, right? Well, I'm a competitive guy too. But unfortunately, when I start looking over some of the data that's available at the state level, we're high up in the rankings in a way that we don't want to be. And so I've printed out some of this information. Y'all can get that on the way out if you want to. Because like I said, I'm going to ask you to be evangelists for us. But this first page, which is the blue page, if you look at that map, we're the dark blue color, which is not good. In fact, we are ranked number 4 if you're looking at the rate of highest rates of medical or drug overdose ED visits. And then if you go to the next one, which is the green is looking at just the opioids. Okay, so what we're here to talk about tonight, narrowing it down to that, you'll see again we're the dark green. So that's number 7 out of 100 counties. So again, way too close up to the top. And then finally, and I'm going to brag on my buddy Robert Sampson, if you look at the purple sheet, right? So this is measuring in the last 12 months worth of data, how many times EMS has been called out for suspected opioid overdoses. You know, we're ranked number 3 out of that. So there's 100 counties in North Carolina, and we on these different metrics are ranked number 3, number 4, and number 7. This is a competition we do not want to win, okay? So we do not want to be in the Super Bowl for these things, and that's what we're here. So one of the things I'm going to ask you to do as you're out among people that you know and care for in the community is bring awareness to how bad this problem is for us.
Absolutely.
So we're a smaller county with a smaller population, but when you adjust for that population, our results are worse than almost every other county in the state. Number 2, as Kevin has said well, substance use and opioid addiction is something that impacts people and has a profound impact. But I'm going to shift it a little bit because I want to tell you how it impacts the folks that work in our healthcare system, in our emergency response, in our mental health services. So all of the time and energy that's put towards addressing this problem is resources and time and energy that doesn't get directed at other health needs. And again, Scotland County has a lot of other health needs for people that have chronic medical conditions. And so when you see this, it isn't just numbers on a page, it's the nurses that I get to be on the team with in the emergency department that are seeing lots of folks come in for overdoses and trying to care for those folks and trying to get them help and the impact that makes on them. And, you know, look, I'm not here just to advocate for my people, but when you sit down and talk with the nurses that work with this day in and day out, and they've seen the same individuals come in time after time, and they can't help them. For people that went into healthcare, that went into emergency services, that went into mental health, when you can't have that positive impact, it really does do something to you. Finally, you know, like Kevin said, so just like, you know, friends and neighbors that are in healthcare taking care of each other and the people that live in our communities, it's also our friends and neighbors that are having issues with substance use. It does affect every family. It does affect the people that you church with. It affects the people that you live beside. It affects the kids that your kids go to school with, the parents that you see at the PTO meetings. And because it impacts us all, it is also going to take us all to be able to make a difference. Because it's not something that these wonderful people that are here in this particular professional field can fix by themselves. It's going to take folks in churches, it's going to take folks in neighborhoods, it's going to take folks in families to get the help to people that need it. And so I'll leave you where I said I was going to. Whether you're a Christian or not, it's a pretty amazing thing that 13 people 2,000 years ago then led to the fact of all these churches that we see around here, right? That's pretty amazing when you think about that impact. And so what I would ask is, even though there's a smaller number of people here tonight, each of you have connections in your communities, in your churches, with your families, to be able to get the word out and to be able to bring awareness. So please, number 1, share with them how bad a problem this is. If it hasn't impacted you yet, it will, unfortunately. Number 2, share with them a request that we would all work together to try to fix this. So again, thank you all for being here tonight, and we really do appreciate it.
Thank you.
And with that, since David already talked about Robert, we'll just have Robert. He's our EMS director, our emergency management director as well for Scotland County.
Thank you, Kevin. And good evening, everyone. I just want to take a few minutes this evening just to share with you some of the local data from Scotland County, as well as some of the state data as it pertains to overdoses. Wanted to go back and just share some historical data with you to show you where we've been and where we are today. So in 2020, we'll go back to 2020, we administered Narcan a total of 169 times in 2020. with 12 deaths that we know were overdose-related deaths. In 2021, we administered Narcan 195 times, and we responded to 197 suspected overdose calls. And in 2022 total, we responded to 217 suspected overdose calls, where Narcan was administered 184 times. Now, a question was asked earlier when we were talking before this meeting began. Why was there a difference in the total number of calls versus the total number of times that Narcan was administered? Not every single overdose requires the medication Narcan to be administered. So if we respond to the call and the person's alert, they're talking, then obviously they don't require that medication. And then we may be responding to a suspected overdose that's truly not an opioid overdose, which would also not require the medication of Narcan to be administered. So as you can see, our trend is trending in the wrong direction. So obviously in our community, we have to own this and know that we do have a serious problem in our community. I'll share a little bit of state data with you, and unfortunately the data is not 100% because they're not through collecting all the data. But what I can give you is, as far as state data, from January through September of 2022, suspected overdoses in the state of North Carolina is 4,243. And they're not even through collecting that data. Suspected fentanyl suspected deaths, again from January to September, is 2,539. Again, they're not even through collecting the data for 2022. So this problem is just not a Scotland County concern, it's a state concern, okay? So this is the realization of where we are. And this should hopefully just validate the importance of us coming together for this type of event tonight and future events, and as we move forward. Some of the things that we're doing on a local level to try to combat this is we have increased the response and how we respond to suspected overdoses. Up until a few years ago, it was just the EMS service responding to these calls. But because we began noticing this trend, again, trending in the wrong direction, we needed to get more resources out to our citizens. So today, whenever we are being dispatched to a suspected overdose, not only is EMS responding, but our local law enforcement partners, both the Laurel Police Department and the Scotland County Sheriff's Department, are also responding with us with Narcan. Okay, because in a lot of cases, they can get to the patient quicker than we can. And if it's needed, then they're there, they can administer that Narcan as a life-saving treatment. We also have our rescue squad, other first responders that have been trained, and they too are also carrying Narcan. So we are increasing the availability of the response to these particular calls so that we can, one, reduce the death as much as we possibly can. We want to reduce those death rates as much as possible. And the way we do that is when if it is truly an opioid overdose, getting this medication right here, Narcan, to them as quickly as possible. And at the end, I will come back and revisit and talk a little bit more about Narcan, why we're using Narcan, and when to use Narcan, and then give you a quick demonstration.
You mentioned part of the protocol, and if there's a suspected opioid overdose, law enforcement is called. So does that mean if Kathy goes off and watches me overdose, should she be worried about not calling 911 because she doesn't want me to be arrested?
No, absolutely not. So the reason why we are including our law enforcement partners is because they're out in the community. Okay, they're riding, they're out. This is a resource to help. Okay, we're not responding to see who we're going to arrest, who's going to be in trouble. The person in trouble is the one that needs us the most. Okay, so our goal is to get as many resources trained and armed with the medication that's needed to save lives. That is our goal. Our goal is to save lives.
Now, just move kind of quickly on with this. We'll go through questions at the end. Of course, Scotland County is not a mental health provider. We do not have psychiatrists on staff. It would be wonderful if we did. But unfortunately we don't. They're in extremely short supply like most mental health providers. But we do have a great partner in East Point. They're also, and the state does not allow them to become a mental health provider, but they coordinate mental health providers for Scotland County. So actually I'd ask our representative for East Point to go off and tell us a little bit about them and the services they can provide to everybody in this room.
Thank you so much, Kevin. It's an honor and a privilege to be here in this beautiful facility, and I'm seeing it for the first time tonight. And thank you for taking time out of your busy schedule to come. I'm honored to be sitting at the table here. We're sitting here united. We're having all kinds of conversation, and it's an integrated conversation. We know we're moving towards whole person wellness and care, and we're getting more integrated, and we're moving towards tailored plans where we are encompassing the medical community, behavioral health, mental health. We're all coming together, EMS, everyone. We have suffered in silence too long. Somebody should have already said amen. I mean, we are ashamed to mention the fact that we are struggling with a mental challenge or a behavioral challenge at the risk of being labeled. That must end. We must stop the stigma. We can no longer suffer in silence and die in the shadow of help. And I just wanted to mention, I have nothing, absolutely nothing to sell you. I'm not here to try to do a pitch. I would like for you to pick up a brochure. Please put one of these on your refrigerator. I also have a magnet out there you could use to stick it on there. It's got an 800 number on it. And the wonderful thing about the 800 number is this is a number that's available 24 hours a day, 7 days a week, 365 days a year for any mental health challenge that you may be having. You will speak to a live person, not an automated phone system, a person that is licensed, a person that will get some social history, family history, medical history, whether or not you've been connected in the past, so that we can make sure that that care that we link you with is appropriate, that it's 30 minutes or 30 miles from your residence. We want to make sure you get what you need. We're not asking for money. We do deal in Medicaid, of course. Most MCOs do, and that's the whole purpose. There's 6 of them in the state of North Carolina. But we do have state dollars, and David and I talked about that in a meeting we had this week. It doesn't matter if you have money or not. We do have money earmarked, called state dollars, IPRS. Some folks refer to it as IPRS money, but it is set aside, and that's to make sure that we have money for you to be treated at the provider that you choose. So please reach out if you know someone or if you need services yourself. Please don't hesitate to call. We're here to serve, and it takes a village. It takes a community.
Yes, it does.
We all have to come together.
Amen.
And thank you for being here tonight.
And the one thing I do want to make specifically clear about with East Point, no one in here deals just with substance abuse. East Point is ultimately our mental health coordinator. So if you have a family member who is, or personally, depression, that number can give you help. If you have someone that's having any type of mental health issue, that number will help. Because frankly, if you wind up taking that person to the hospital, to the ER, where a lot of people go, the hospital also calls that number too. They have a different number, but East Point is going to be brought in. So go ahead and do that. And good thing of it is if you have somebody who's suffering from any mental health issue, they can help connect you to someone who can, an actual provider that can help you before you have to go off and spend 3 days in the ER because now you might be a threat to yourself or someone else. And actually, one of our other members with East Point for our geriatric.
Yeah, I'm Mary Susan Baggett, and I'm with the North Carolina Geriatric Adult Specialty Team, which is a special component of service through the North Carolina Department of Health and Human Services and Division of Mental Health. And I'm paired with East Point, so my days are with Robinson and Scotland County. And in particular, the support I provide is to be available to go out through the community to either provide professional level training and services or just discussions and presentations to non-professionals about mental illness, substance use and recovery, and general emotional wellness, brain health, dementia. I do training in care facilities. I come right next door to our senior nutrition site and provide some ongoing conversations just to help better inform the seniors in the community and hope to get correct information that way, because you know we all hear a lot of things and we pass it along as the gospel, but we've just heard from somebody else who didn't really know the facts and they were just passing on what they had heard their neighbor tell them or what their grandma used to say. So it's all about informing people by getting the right information into their hands so that they can best guide and direct and influence their neighbors, their churches, their families, and know how to get help themselves. So that's my role. If you know of an opportunity where you would like to have issues that are related to seniors as well as other adults, then you know that's what I do for free every day, is to go and have these conversations and let people have an opportunity to ask questions.
And you have information out there.
Yeah, we got some flyers out there and some pamphlets.
And one thing that she is going to ask, does ask for something from you. And I'm going to have still no, but if you have a church night, invite her. She'll come and she'll talk to your church. If you have a fellowship, if you have a men's group, a ladies group, a book club, Kiwanis, Rotary, whatever.
I've been to the Rotary here.
Yeah. She's happy to come in and talk. And because that also, any of you who have gone from being the kid to being the caregiver for an adult, you understand there's differences there. In addition to substance abuse, but also with other issues, and she's a great resource for that. So she really wants groups to invite her in so she can go off and give them information and point them in directions to get assistance.
I'm busy, but I ought to be busier than I am.
Yeah. We want to run everybody here ragged, except the EMS.
Yeah.
EMS and 911, Actually, I want them to sit down and do nothing, and law enforcement. I want them to do nothing but get cats out of trees. I've never seen that happen yet.
I would like to plug Laurel Hill Community Center. We have 3 sessions with Mary coming out. We're calling them Chat and Snack, where she's going to come talk with our senior bingo ladies. So we're
Yeah,
already.
and my
trying to
first
do
topic is gonna be on fentanyl.
that. Yep.
So, now also came in, you noticed a trailer out in the parking lot. And some of you may have no idea why it was there. But with that, I want to ask Stevens Outreach Center to go off and tell you about it and some of the services they provide.
Because it's not a food truck.
No, it's not.
That's what I thought it was, and I walked that way. No Doritos. No.
My name is Korea Rogers, and I work with Student Outreach. I am a peer support specialist. I work the mobile care unit. We are located different sites each day. We provide mental health and substance abuse services, therapy, peer support, and something else.
Yeah, you got all that.
Yeah, that's all. But we're set up in different sites. Mondays, we're set up in Scotland County at the DSS. Tuesday, Biggs Park Mall in Lumberton. Wednesday, we're at DSS in Lumberton. Thursday, we're in Red Springs. Fridays, we are in Rowland, North Carolina, off of Martin Luther King Drive. And Saturdays, every first and third Saturday, we're set up in Fairmont or locations where you can request for us to go. And we're up there from 9 to 4 every day.
And I'm Amanda Locklear. I also work with Stevens Outreach. I'm a peer support specialist. And I was just sitting here reading my own material. But what I do, I help individuals learn their own recovery and their being an advocate for themselves. And help them find coping mechanisms instead of turning to drugs or alcohol or being in an abusive home. Find things to do to keep you busy. Find things to occupy your mind, to keep you focused on what you're doing. And I tell you, I've been working with Stevens for 2 years. And I had a consumer call me last night and said, Miss Amanda, you're going to be proud of me. I said, why is that? I said, I'm always proud of you, but what's special about today? I didn't pick up my gabapentin today because she was abusing them. She said, and I don't want that life anymore. She said, but I need your support more than ever. Even simple pills like gabapentin, but that makes me love what I do. I'm very passionate about my job. And we have so many things. We have the individual therapy, group therapy, family therapy, individual therapy, substance abuse, clinical assessments. We do medication management. We have our doctors there that can go over medication that the individuals need. We also have what they call SAOP. That's for adolescents and youth. And that's 3 days a week, Monday, Wednesday, Fridays. You actually go to the center and you're in a class, a substance abuse class. And we also offer SACOT, which is 5 days a week. We even pick you up. If you know anybody, we pick you up and take you back home just to keep you in that class. And it's it's helped so many other people. But we offer so much. We have a crisis team. We call it Community Support Team, CST. And it's for individuals with mental illness, substance abuse disorders, or both that has very extensive, issues going on. But there's so much that Stevens Outreach does offer for the community, especially when it comes to depression, any type of mental illness, and substance abuse. And I'm going to feed off of what Korea said about the mobile unit. What I learned, I worked the mobile unit for a while, and what I learned, people will come to that mobile unit versus going to our office because of, like what you said, not being seen. And that's what they need to know. They can come to that mobile unit and we have a computer, everything set up, where we can do our virtual assessment. We have clinical, social workers, right, that we can tap into right then and do an assessment. And they don't have to go in there to the office to be seen by a lot of people. So it's very beneficial. And I love, like I said, I love what I do, and we do have a serious problem. And it's not just drugs. The depression, that's real. The mental health is very real. And I'm in Robinson County. All my consumers are in Robinson County. I was asked to take one in Scotland this week. I'm not, I got to look at everything, but it's real. And we have a lot of issues out there, and we need people to come together and we need to come together as a group.
I wanted to say one thing that's so important about this mobile care unit that has just come on board with us. We've had it about a year now.
Yes.
Here in Scotland County. What's exciting is the fact that that mobile unit can go to various parts of our county in different areas where to alleviate some of the where people can't get to a specific
Right.
location. It makes it easier for them, again, reducing the stigma.
Right.
People not knowing exactly what it is. It doesn't have anything on there about substance use, but it's a wonderful thing that is going to be able to travel and park at different locations in Scotland County. We're working on that now. And so it's a wonderful thing to have where people can go. So what we're responsible for then in being here is learning about what resources that are available and who we could call, who anyone here can call to find out. I don't know everything either. I'm a health educator with the health department, and I'm responsible for providing education, information, prevention efforts, promoting things that are going on, which is what we're doing tonight. But this is an important piece in making sure that we are making ourselves available and getting the information out to concerned citizens, concerned people like all of us are, so that we're aware that there are resources. Nothing's easy.
No, it's not.
Nothing is easy in this, but it can be better. We can make it better, and again, by all of us working together. But everybody knowing, hey, I know somebody you can call. I heard that lady talking. Let me call. I don't know who she was, but I'm going to call the Laurel Hill Recreation Center. Mm-hmm. That lady would know who I need to contact. So, those kinds of things. But it's all working together, I think, and everybody understanding that the resources are here. Again, it's not easy, but it can be done.
And we also have pamphlets and information outside at the booth set up. So.
And you can tour the mobile unit afterwards.
I have two questions for you. First of all, since this is an opioid themed meeting or purpose meeting, what if I'm not having an issue with substance abuse, but I have depression, I need to get my meds straight back out for psychotic breaks, or not that bad, but I need some other, can I?
Yes, you can.
We have a clinic too.
Yeah.
And also, when I need to see you, how far in advance do I need to call and make an appointment? 6 weeks, 9
You're
weeks?
talking about for my personal?
The walk on that?
No, you just walk up to it.
Okay. So no
Anytime you see a
appointments?
park somewhere, no
So
appointments.
if I need mental health and I see this in front of the parking lot at DSS,
Run to
and
it.
it's right there on West Boulevard, if you miss it, you're not looking on that side of the road. On Mondays, please let people know it's there.
And see, that's the thing, a lot of people say, we'd like for you to come here, but we have to have permission. And we have to, because you just can't park it anywhere.
Right, and that's one of the things I said we're working on.
Yes.
Getting that. But please introduce that lovely couple that runs this mobile unit all over the place for us.
Yeah, so I'll just share it with everybody. And now, since we started off the evening with a hospital, we're actually going to finish the night with, or the presenters tonight, also with the healthcare system as well. And David and I kind of are on vision and operational side, but then again, but he is also wise enough to bring somebody who knows something. Like I bring Robert and Kathy, you know.
So Tina Dial is the superhero in here, so.
Yes.
Will you tell a little bit about the work that you do in our practice locations?
Yes, hey guys, Tina Dial, I'm a licensed clinical social worker and licensed clinical addiction specialist. And the work that I do is, I go out into each practice, go out to the different practices, like, for instance, on Monday, I may be in Wayland. And then on Tuesday, I'm in Maxton. So I'm able to go to different practices and present the sessions and stuff.
So one thing that's exciting about the work that Tina does is, folks are concerned about the stigma that Kevin talked about. So when you go into one of our doctor's offices, nobody has a clue. Are you going in there to get your sugar checked? Are you going in there because you've got the high blood, right? And so we found by having the substance use or the mental health services located at the same place that people's family doctors are, or your nurse practitioner is, that's a way that you can get in there and get the care that you need without having to go, feeling like you have to go another county over because you're worried about it. And we're really thankful for her. So she goes to Pembroke, Laurinburg, Wagram, and Maxton. And so a total of 5 different practices. And she's got sheets with all the information out there where she's at. And so you can call any one of those numbers and Tina, we get you signed up to be able to see her or somebody that you know.
Yeah, I think it's pretty cool too that, with individuals, when they come to the practice, it kind of breaks the barrier and the stigma that's associated with mental health or even substance use. So no one knows. So we're under the same umbrella. And that makes a difference.
And her job really is one of those that's the whole concept of the whole person wellness, the whole health wellness, because most of you, if you have a primary care doctor that you've seen, or a PA a lot of times, I've been seeing mine for years. I go in and, hey, this is going wrong, okay, this is it. I trust them. It's already a relationship, so hopefully you're willing to go off and have the conversations or start conversations, hopefully earlier than later, and they can help connect you, making sure that you're getting those services that you really need.
And I forgot, we have 3 locations, Lumberton, Fairmont, and Laurinburg. That does the same thing at every office.
So, where's your Laurinburg office?
Railroad Street, I think it's called Railroad, East Railroad Street.
Okay. So, thank you. And with that, the other thing, of course, Robert was talking about using Narcan, or Narcan or naloxone. Basically the same thing, different brand. But he's actually going to give a demonstration on this. And also, if you need or want some of this, we have some to take home, I believe. Now, with it, and well, I'll let him give his number, let him give the demonstration.
So a little bit about Narcan before I actually get into showing you how we would use it or how it's to be used. In 2013, the state of North Carolina deregulated Narcan. And the reason why the state did that was because we were entering what they call phase 3 or the third wave, if you will, of overdoses because the synthetic, that was right during the era of the synthetic medication coming on board. That's when people were making the fentanyl in their basements, in their garages and stuff. So the state deregulated Narcan. So what does that mean? That simply means you no longer need a prescription or a doctor's order to be able to get Narcan. Today, you can go to any local pharmacist, your pharmacy, or any local pharmacist, and you can purchase Narcan through them now. It does not require a prescription. And there was also a change made to the Good Samaritan law. You may or may not have heard of the Good Samaritan law. But what the Good Samaritan law does, it protects you, the individual. So now, if you were with a loved one or you come up as a bystander and that person is suspected to be overdosing, and Narcan is available, then you can administer Narcan to try to save someone. And the Good Samaritan law will protect you. And how it protects you is because now the Good Samaritan law says it will protect you because you are acting in good faith. Okay? To not cause harm, to help someone. Okay? And I know that's been a huge stigma over the years of, people wanting to help someone, but they're scared to. Okay? Because of being sued. Well, now the Good Samaritan law is in place to protect the citizens. Okay? So I think it's important that everyone knows that. So if you were at home, or if you're with a loved one that we're at a residence and there is a suspect of an opioid overdose, and you've heard me mention opioid overdoses. Well, I'm saying that for a reason, because Narcan is only effective if someone is suspected to have taken some type of an opioid medication. Okay? That could be Tylenol 3 with codeine, all the way to fentanyl. Okay? If someone is suspected to overdose on just regular Tylenol, or someone took a bottle of aspirin, this medication will have no impact whatsoever on the person. So, if someone is suspected to be having an opioid overdose, what are you looking for? Okay, number one, has someone taken a medication or something that you suspect may be an opioid drug? Number one. Number two, you want to look for the signs and symptoms of it. That would be if someone is unresponsive and if someone's respirations are declining, which means they're not breathing adequately. All right, and the reason why you're looking for those two things is because what the opioid medication does to the body. Once someone takes too much of it, then the opioid, the medication, it attaches to the receptors to the brain, and then you start having the adverse effects. All right, it starts affecting your mental status, and it starts affecting your respiratory drive. Okay, and that's what kills people. It's because it suppresses the respiratory system, and in essence, they stop breathing. Okay, and that's why people die of an opioid overdose. So what Narcan will do is, once it's administered, it will bind to the opioid receptors in the brain and start reversing the effect of it. Okay, so once the Narcan is on board, the medication, the effects of the medication stops, and it starts reversing it. In just a few minutes, or possibly a little longer, you start seeing the positive effects of the medication kicking in, which means the respiration start improving, which is what you want to see. And as time goes along, then they will start waking back up. Okay, so that's kind of the history there on why you give it and when you give it. So now I'll just do a quick demonstration on how you give it. So the Narcan or naloxone that you would see in a pharmacy or whatnot is what they call intranasally. Okay, And this is the exact box that you will get at the pharmacy. Okay? Simply, all you do is you hold it between your fingers. The red, I call the little red button is the plunger. And you want to insert it right up the nostril, doesn't matter which one. And when the person takes a breath, you want to squeeze at the exact moment that they take that breath in. Because once they inhale it, then the medication will get into the membranes and then get where it needs to in the body to start working. So you insert it in, and when that person breathes, you squeeze. Okay? And that's it. And now you wait. Once you administer it, it's not going to take effect and it's not going to start working in the next 10 seconds. It will take some time. Okay? You want to think about it taking up to 5 minutes potentially. Okay? Before you start seeing the effects of the medication. Okay? And that's the quick demonstration.
Now, with that, if this is the situation, hopefully you're already talking to one of our people who are managed back in the back corner. You already have called 911. They can also help you walk through it. They will ask you questions. They love asking questions. They have hundreds of questions to ask.
That's what they do.
That's what they do, because yes or no means left or right. And they're going to tell you. So they'll tell you, okay, you tell them, yes, they took something, by the way, I have Narcan. Okay, are they breathing? They'll guide you through it. Do I need to go, they're not awake yet, do I need to give them another dose? They'll tell you, no, you need to wait. And eventually, they know how far the ambulance is, or help is, if there's another dose.
Kevin, I'm sorry, I'll just add, what we're starting to see when we respond to homes, even if it's not a suspected overdose, we are starting to see more and more and more of Narcan being in the home. Okay? We are starting to see more of that. So if you're going to visit someone and there's an emergency there like that, ask. Hey, do you have Narcan in the home? Because we are starting to see more and more residents having Narcan in the home. And obviously when we see that, that's a good sign that, hey, people are being proactive, but then it also lets us know, okay, this Narcan's in the home for a reason. We may not be there today for suspected overdose, but that's going to be in the back of our mind because it's there for a reason. Okay, so just information to share with you.
So Robert, if I wanted some Narcan, if I'm a mom, somebody, that maybe uses it, or I'm afraid they may overdose, where would I get Narcan?
So you can get it at any pharmacy, okay? Now, any pharmacy, you're able to get it without a prescription, okay? That's where the deregulation came in that the state did in 2013.
How much?
I personally don't know that the actual prices from the pharmacies. I think
They're different.
they're different prices. It really is, depending on Walmart's price might be different than Walgreens' price. It may be different than, the more local.
But they'll work with you.
Yes,
I've
but
heard that
they
they'll
will,
work with you.
it is our understanding that they will work with you, if there's a financial issue there to be able to purchase it.
Can I ask a question? How many repeat, well, you probably don't know that, but how many repeat people come in with overdose, and before they repeat, this demonstration was very simple. Can you teach them or their family members how to use it? And then give them some, because if I come in for an overdose, right, I'm overdosed, and, my family comes up, and I'm okay. Can you teach my family how to use the Narcan, so if it happens again, I'm there and possibly able to save their life?
Sure, so to answer your question is, can we give instructions? Yes, we can, because again, the medication is deregulated. There are a lot of other places in the state that with grant funding, have been able to get their hands on a lot of Narcan doses. So whenever EMS responds to a call, if we respond to a suspected overdose, before they leave, they'll leave some.
Good. With the
Okay.
instruction.
With instruction, in which instructions come with it. But obviously, in the event of an emergency, you've got time to read instructions. That is an interest of mine for us here in Scotland County, to start looking at that and moving in that direction. I know Kathy and I had a conversation just a week or so ago, to where we're looking at, possibly doing some things on a county level, to ensure and get the word out that, hey, we want to help in that regard. So we are looking to be proactive and see how we can best make the Narcan available to our citizens
Yes. At no cost.
at no cost.
Yes, okay. That's right.
Yeah, the statistic that you gave us, Scotland County, is there any way that you know whether some of those people are repeated people, or they all friends?
As far as the number of overdoses, I don't have it from a percentage, but yes, I can tell you that we do have repeat offenders.
Okay, but at the same time, are you allowed to send people to, what's your name, sir?
William Sellers.
William Sellers.
So we can recommend it, and give them the information, but we cannot force them.
Okay, Mr. Sellers, are you allowed to, you deal with your people have repeat, are you allowed to send them anywhere else after you get through with them, or you just, how do you do with repeat people? Can you tell them, say, listen, this is a church here, or can you tell them about another organization? What do you do this, when you get through with it, what do you do?
Right, a lot of those calls will come through the call center I was telling you about, whether it comes, and anyone can call the call center. It's open to anyone, it's open to you, it's open to professionals, anyone, and we can basically get them in touch with whoever they need for that level of care that they need. If they want help for substance misuse and that type of thing, we'll get them connected with a provider.
The reason I said it because I pastor the church and I know that everybody's not coming to church.
Yes,
Everybody's family's not gonna come. So it's being able to tell that person, family, listen, pick up the organization in Scotland County that you can go to.
That's right.
But I need to know, once you get through with that, I need to get in contact with them to be able to bring them to the church. You know what I mean?
And I think one of the things that's important that everyone needs to know, that there are laws out there that prohibit us from sharing information. And those laws are called
I understand that.
So even though, to go back to your question about the repeat offenders, yes, we have them. And when we respond to them, we encourage them, we give them brochures, we try to educate them. But at the end of the day, without their consent, I can't reach out to these organizations and say, hey, we've got someone here that, that you can benefit from without their consent, because then I'm violating their HIPAA rights.
Yeah, I understand that, yeah. But I see it in Scotland County, because I deal with the jail, I deal with the streets a lot. But I see a lot of repeat.
Oh, absolutely.
I mean, repeat.
Absolutely.
I mean, off drugs, 2 months, 3 months, or how long. That's the thing about it. Not the newcomers, but the repeat people.
Yes, sir.
I mean, and some of them to the point where that all they're doing is keep using the organization. They don't, what I mean? They keep using the organization. They're not recovering. You know what I mean? It's just like somebody called EMS Monday. A month from now, they call the same people calling you again. That's the problem that we have in Scotland County, is repeating. Not only going to jail, but
It's that where everywhere.
Yeah, I would say it's not just Scotland County.
It's not just.
I'm not saying, I don't
It's
know
the
about.
nature of, it's the nature of addiction.
But to your point, it's a major concern, right?
It is.
And it is a problem, and we identify it as being a problem. And this is where, like we've all been saying, this is where it all begins. We come together to combat the problem that we are now identifying.
We're in a helping profession. That's what we do. we never, ever sit in judgment. You know, we can't say this person's been a repeat of Narcan 5 times. We cannot sit in judgment. We're gonna respond, we're gonna treat that individual just like they show up at David's hospital with a heart attack. Say, well, look, you showed up last month with a heart attack. You know, how much is enough? We're in the helping profession. That's what we do. And I just want to say one thing about Narcan. East Point has worked diligently and very hard. And anytime we have pots of money, and we don't have a lot of pots of money left, but when we do, we purchase Narcan for 10 counties. We give it to all of our EMS, law enforcement, at absolutely no cost. And we have an exchange program to make sure that we keep up those expiration dates, and that has to be valid. And that we exchange that and it's not wasted, so we don't waste those resources. So that's just one of the things that we're very to do, is get Narcan out there, because it is not cheap. Like someone asked, how much does it cost? It's expensive. It's expensive. But we're working on that, and some of our opiate settlement organizations are also looking at ways of how to make Narcan available in the community. You know, some of the jail programs. If you look at some of the at the state websites, you'll see that some jail programs have the vending machines, and that's some of the things they're entertaining and some of the conversations that's going on. So, you know, we're looking at all of that.
And you were talking about repeat offenders. My thing with that is I've dealt with a lot of that. And there's other issues going on a lot of times in that person's life that causes them to turn back. It's a trigger, what causes them to trigger. So therefore, that's why you get them involved in an organization where they got the therapy, they got intensive in-home therapy, we got the drug classes, and there could be like a certain medication, there could something going on mentally that's causing them to always fall back and repeat what they're doing. So we got to look at what's behind that, what's causing them to what's causing the triggers they're having.
And referrals to other types of resources that they might need. Because other stressors in their life, like food or childcare or.
I got a client that money triggers her drug use.
That's right.
Money.
Can't handle money.
She can't handle money. If she works one job and makes $10, it's going to go in.
I know, but in our organization, we always call it, what triggered the organization, we always call it the devil.
Yeah. That's true. That's
we call
true
it the
too.
devil.
That's true
The
too.
devil
I
pimped
agree.
you. You didn't ever realize he was pimping you.
Yeah.
And that's why we're also working to coordinate services all along that.
As a peer support specialist,
Yes.
you have to have had the experience of being addicted, am I right?
Not necessarily to drugs. It could be any kind of mental health issue, but you have to be recovering from something.
Yeah.
It doesn't have to be drugs.
Doesn't have to be.
No. We're trained on that. Mhm.
Because it's been my experience that when people have an addiction, they like to know that the person who's helping them was once an addict.
Yeah, I've not run into that issue, and I've been doing it 2 years.
Everybody has an addiction, whether it's food, clothes, shopping.
Cigarettes.
Yes,
Everybody has an addiction.
we all have.
But it's been my experience because I was one time an addict. I was an addict for 30 years. I'm 16 years clean. And what I've noticed, I don't say that for applause because, you know, I'm driven to do this. And what I've noticed is the stigma comes from the addict being judged. Now, when an addict is on the street, they develop a seventh sense. They have to be able to recognize who can hurt them and who can help them. Because their survival depends on it. I know this because I developed that sense. When they come into a room, that sense is still there. And within the first sentence or two, they'll know if this person is going to judge them or help them. And if they feel like they're judging them, they leave.
Right.
If they feel like they're judging them, they may show up, but they're not getting anything. They're just showing up and sitting in the room. I've seen this many times. So there's a disconnect. with the people who are providing the service and the people who need the service. So as a peer support specialist, this is why these people are so important. They can relate to what they're feeling. There's a connection there. You can pull up anywhere around here, but people are not going to come to you because they don't trust you. They don't trust that you're going to help them. They think that you're going to judge them. And it's the judgment in the street that keeps them in the street. That's the stigma we're talking about.
Right, well, like you said, I understand exactly what you're saying, but like I said, in my 2 years' experience, I've never had that issue. I
I've
would
been doing
say,
this now for 10 years.
yeah, 75% of my clients are it's drug abuse. And I've never had that issue with them because I never judge my clients because I have my own addictions. Cigarettes, I smoke, okay? That, like she said, that's an addiction. So I can't judge her. My addiction is just as bad as your drug use.
I understand what you're saying, but if you have an eye problem, you don't go to a heart specialist. You understand what I'm saying?
Yeah.
So if I come to you, I want to know that you understand what it's like
Yeah.
to be on crack cocaine,
I mean, I get that.
addicted to opioids. That's the disconnect I'm talking about.
Right.
We need people who can connect because they've actually walked in their shoes.
Right.
That's what we need. When we start getting more people like that plugged into the system, then you're going to start to see a change.
And part of that is we need to make sure more people understand the resources that are available in general. So we have more people who are recovering. And it is never a cure, but it is recovering.
Right.
And part of that is, you are absolutely right. If I'm going in here because I'm court mandated, okay, I'm here.
Exactly.
Go ahead and talk.
Because
Or if, hold on, I'm actually doing this because my family member has actually said something that has driven me to say this. At that point in time, because someone is understanding and I'm not feeling judged, that's when I can make a connection. But thereafter, there's still a 90% recidivism rate in substance abuse.
And see, that's another stigma. And I hear that a lot too. They say relapse is a part of recovery. We got to stop telling people that. Because that's a crutch. That's a crutch. If I fall, okay, I'm expected to fall. We got to change that.
That's right.
We got to change it. We can't keep telling people that. Now, AA, they've come up with it, oh, relapse is a part of recovery, you're going to be fine. No, you're giving me a reason to get high again.
That's right. That's right.
That's what that is. So we gotta eliminate that speech. You're coming for help, we're gonna find out what it is that's causing you to want to use drugs. And 9 times out of 10, it's a lack of love.
And
It's a lack of someone who cares. Because when someone cares, you'll see a difference. I'm here today because somebody cared about me. Like I said, I was an addict for 30 years. Nobody cared. But when the one person did care, it changed my life.
That's at that point where there is somebody that helped you realize your self-worth.
Yes.
That's at that
And that's
point.
our job.
And never expect that you're gonna fail again.
That's our job.
That's right.
That's our job.
That's right.
To teach them their self-worth.
Self-worth.
To teach them that they're here for a reason.
Purpose.
To teach them that they have purpose.
That's right.
that's it, bro.
That's right.
That's how we get it.
That's right.
We teach them about the conscious and the subconscious mind, how it operates. What you think about all day, you become. Your behavior is connected to what you think about. So if I change how you think, then maybe I can change what you do. That's how this has to work. I don't want to know with all due respect, I don't want to know the doctor terminology about the synapses. I don't care. I don't care about any of that. What I care about is getting better. How am I going to get better? I'm going to teach you how to love yourself first. I'm going to teach you that you're not the worst thing you've ever done. I'm going to teach you that you can come back from this. I'm going to preach the serenity prayer. God, give me the serenity to accept what I cannot change and the courage to change the things that I can. That's what we teach. That's how we reach them. That's how we stop the recidivism. That's how we bring our people back together again. That's how we reduce crime. That's how we reduce overdose. That's how we change our community. We get the families back involved again. We bring them in on the sessions. We let them see the progression. We have them continue to push what we're teaching. It's going to take a village. It's going to take a family. That's how we make the change. That's why I work so hard with East Point. I've been trying to get into this organization for 10 years now to become a provider because I know what works. I talk to people now. I have at least 7 people who call me on a regular basis just to talk to me, to tell me what they're going through. And I teach them how powerful the mind is. I teach them about the subconsciousness, the content of the subconscious mind. I teach this. And they respond. I had a friend get off of alcohol. His marriage was falling apart. But I taught him about the conscious and the subconscious mind. I taught him how the two work together. Saved his marriage. Turned his life around. Unfortunately, he died. But he died clean and sober.
And that's the passion that David was talking about earlier on. We need everybody in this room to be an evangelist. You know what? We do need people to be family support. We don't want substance abuse to tear families apart. But I don't have the skills of these ladies in the back. A family member, I can be there, I can support them, I can love them, but I'm going to love them on my way to talk to somebody who knows more about it than I do. You know, and that's really where it is, and that's why we're wanting to do this. And some of this is also trying to figure out, not only that, but also what are some of the things that we can benefit in the community for. We are looking at creating a coordinator that can actually, we know there are gaps in between our agencies, so we're looking to make sure we can fill those. So, you know, if there's any other issues, hold on, we know that we're having issues in this community and my family. For me, you know, we're open to listen to that, and we want to find ways of addressing those issues. And I know, you know, county manager here, I'm with government, I'm here to help. I'm not the guy any of you are going to listen to. None of you are going to come to me for help.
Yeah, for the county.
But the real trick to it is, if I'm aware of an issue, I can talk to the people around this room who can give you the help you need. And I can help coordinate them working together for you. And that's why we're here. We want to just really want that conversation to be there. So as a community, and it was said several times, it takes a village, you know, and that's why we're here today, so that hopefully we can make the conversation a little bit less tough, so that we can take one hurdle away from the courageous steps it takes to find somebody who can help.
I've listened, and I'm the mother of a redeemed addict. One issue that has come up for me in wanting to support my son is recovery. Now, I've heard him mention AA, but other than your function, are there any recovery groups?
Yes. There are, at Prospect United Methodist Church on Wednesday night, there's an AA group that meets on Wednesday nights there. That's an AA group. There's also Stop the Pain, which has integrated with Paul's, and they meet 2 nights a week, Tuesday and Thursday nights. You're right, we have to build a recovery community. A recovery community has to be built.
So that's where we're lacking.
Yeah, a recovery community. If you don't have a recovery community, you cannot, it's impossible to support what you're trying
A
to
good
do.
support group,
Yeah.
but it's a recovery community, I love that.
But the thing about
And
AA, they still saying that I'm an addict.
Yeah, stop. Stop.
That's the thing about it. Every time they go to a meeting, they're speaking, I am an addict.
My name is such and such, and
I'm
I'm
an
that.
addict. You know what I mean, I've been to those meetings, not, you know what I mean, I came together in 1984 from the world, you know, but anyway, that's a long story, but the thing about it is that they say that, I think what we need to do in Scotland County, is a guy like yourself, myself, and other guys, is begin to have a meeting and invite people that like our son, let them, to be able to point to them, let them understand the purpose and destiny that they can have for their life. You know what I mean? Instead of, because when your son comes to meet with me and him, we're not going to let him come and let's say he's an addict.
No.
No, that's not, we're not gonna know. No, that's
Words
not.
have power.
Huh?
Words have power.
Yes.
Yeah.
Words have power.
So, I can get with you and we can be able to start meeting with guys. We can meet in my fellowship hall, we can meet in other places. You know what I mean? And then when people got family members that we can't get to, we can say, okay, then we need to send them here. When they come from there, then we can be able to deal with them again. Or we can tell them, say, listen, I'll meet you. If you don't want to come to church, I'll meet you. There's a bus in Lombard, supposed to be there a certain day. We can go in there and they can be able to help you. To let you know that we don't only care about you spiritually, but we care about you physically. And help you be able to find a foundation. Once you find a foundation with her or with him or in the organization, then we can reach out to them and say, listen, we got something else for you now.
It's gonna take you and me to get him in the door, and then we can.
Yeah, but being able to use these different organizations, because everybody's not gonna come straight to your church and say hallelujah and praise the Lord just like that. But you got to be able to grab hold of these resources and let them go there and be able to catch when they come back out the door. And then we can be able to deal with it.
prevention.
That's the word.
Prevention. Starts with prevention. What if you have this amazing building, and what if you bring in your children, you got to start somewhere. I mean, you can't save the world, but you got to start somewhere. So what if you're bringing in your children, you're teaching them coping skills, you're teaching them how to live life and be happy and without a substance. You're teaching them how to live life and be free without a substance. What's wrong with a sobriety dance or a sober? What's wrong with a dance? What's wrong with a dance without the use of drugs or alcohol? You don't have to have those things. If we don't teach our children those things, then it's not going to be possible.
You see, when it comes to drugs, people do drugs because there's something missing. There's an emptiness on the inside of them. And they don't know how to fill it. So they try different things. Have you ever just sat down and asked a young person, what would you like to be? Have you sat down and asked an older person, when you're the happiest, where are you? What are you doing? If we can't get to the inside and figure out what's going on the inside, we can't do anything. We can't touch it. We got to teach them to love themselves again. We got to teach them joy again. We got to let them be able to use their imagination to go to places where they feel happy again. That's the foundation. So whenever these urges pop up, they know, okay, I'm going to go to this place and feel happy again. And the addiction, the draw of it doesn't last long. It's not like it's constant 24 hours a day. No, that's not what it is. But it'll pop up. And if you don't have something to redirect, it'll drive you until you get that drug of choice. So there's a new and exciting way to do this. A new and exciting way to do this. And we start with self-love. We start with self-love. Do you love yourself? What makes you happy? Where's your happy place? You know, I tell the people that I work with, a lot of them say the beach. So I tell them, go. In your imagination, go to the beach. Go. Feel the sand between your feet. Feel the salt water as it blows up. Feel it. Go there. Go there. And once they get used to doing this, when the urges come, they can go there. Will it be easy at first? No. No. Because addiction is powerful. And it's not going to just turn away because you don't want to use it. But if you do this on a regular basis, the pull of addiction gets weaker and weaker and weaker. I'm 16 years clean, and I never went to any AA program or anything like that. I made a decision that my life is worth more than this. But I had to figure out what it is I wanted to do with it first. The neighborhood, they make fun of people who have dreams and visions and goals. They make fun of them. They make them feel bad about it. That's how the gangs get them. That's how the gangs reel them in. You got, what do you think? Man, look, come over here and try some of this. That's how it starts.
You know, bottom line with me being evangelist, my goal would be to take them back to Genesis, the first chapter. Verse 26, you were created in the image of God.
Yes.
You were created in the image of God. You have purpose. You have purpose. And to help them to understand what those purposes are. And to be realistic, there are spiritual demonic forces that are here to destroy the race of mankind. That's bottom line.
Always have.
I mean, we deal with all the physical and the medical and all these other auxiliaries and whatever to help, but the bottom line is to understand that you are somebody because God said so.
And you have the power to create your own reality.
And then all these other entities that we're talking about are going to be resources that help the physical man, while the spiritual man will
Be reborn. Yeah, absolutely.
And that's part of the reason for the meetings that we've had, is to start that conversation, because, like I said before, I'm not the one who's gonna help. But y'all are gonna be the ones who are gonna walk your family members to see somebody who can help. But it's gonna be you who's there supporting them to go back for the next, the second, the third, the ninth, the 100th meeting. Any other questions? And if anybody is interested in Narcan, I think you do have some here tonight? Oh, okay.
Well, we can take care of that.
Okay, but if you need any, let Robert know. We can see about getting you some. And also with the Narcan, I will put in a plug, because I know this last meeting I took home 2 boxes, one for my daughter who's in a sorority, just so she can have it in her sorority house.
Good idea.
Told her, don't keep it in your room, but, downstairs in the kitchen, and let everybody know about it. But also, I have a parent who, just because of normal medication, has pain management as part of it. What happens if they forgot they took their medicine today and they take 2 doses or, whatever? So, Narcan is not just for addiction. It is for people, anybody who misuses intentionally, unintentionally, any type of overdose.
That can happen unintentionally.
Can I ask a question? Does the mobile care unit, I'm with the health department, does the mobile care unit provide Narcan to someone who may come up to you and say, I need some help?
Yes,
Are you
ma'am.
all, or will you be able to do something like that?
Yes,
I
ma'am.
didn't know. Okay, so then that's another resource. One other thing I want to tell you all about, Robinson Healthcare Corporation could not be here tonight with you all, but the health department does collaborate and partner with Robinson Healthcare Corporation, providing a campaign called Lock Your Meds. You may have seen an ad on Lock Your Meds, wondering what is that? They do provide resources such as this little bag. I've got plenty of them for everybody. Please take one home so that you have one and you can show someone else. This is called the Terra, And what this is a drug deactivation and disposal in a safe way, because we all need to know how to dispose of our unused, expired medications properly, not flushing them down the toilet. But this is a bag that all you do is tear it open, you fill it with water, you put your pills in there or whatever's left over, fill it with water, and it gives you the instructions, easy peasy. And it's just like a zip, and then you're able to throw it away. So this is one, and the other thing are lock boxes, and those are for people who take several different types of medications, or maybe even one, because there's different sizes. I didn't bring a sample to show you, but we do have them, and they are free to the public. But that is, so a lot of older people may not have the capacity to manipulate the lock that goes on the lock boxes, or may forget the code that they've chosen to use. But this is easy peasy. If you have someone in your family who's taken lots of medications and has passed, what do you do with all those medications? You certainly don't put them in the garbage can in their containers. You don't flush them down the toilet. They don't really know what to do, and we only have one time a year, maybe the take back your meds, where you drive through and you take all your medications to. So this is one of an easy solution for that as well. So this is just another thing to share with how to dispose of medications safely, and also how to prevent others from taking medications that you may have in your home that you don't want out on the streets.
Anybody else have any comments? Please go off, stop by. There's a lot of material out here on the table. Speak with any of the providers. They have great resources. Stop by the mobile care unit.
Can we pray before we leave?
Sir?
Can you pray? Yeah. And we can have